invoices. I wanted to respond to the question of SHA and the facilities that were said not to have existed, and I think it is very clear that in naming of places, many areas have the same name, and in this case, we had a facility that we are yet to open in Nyandiwa in Kasipul constituency. It is a dispensary. And then we have Nyandiwa Level 4 Hospital, which is in Suba South, which is a facility that has been in existence since the 70s. So apart from the political spin that the issue got, these are two distinct facilities. And recently we received the Health Committee of the National Assembly that came and saw both the facility in Kasipul and the facility in Nyandiwa, and the kind of work that the facility in Nyandiwa has done, even with their FIF, they were very, very impressed at the improvements that have taken place in the real Nyandiwa. But I think there was a political spin to it. I just wanted to make that clear since Senator Cherargei raised it. So the question of are we that sick does not really arise. I think people get sick and go to facilities, but the reason for increase of revenue is very, very deliberate. Very, very deliberate in terms of getting our revenue collection and administration in order. And Chairman, there was a question you asked earlier about how do we project. And I wanted the Chairman of the Revenue Board, who's also a long-standing, retired from KRA after serving there for over 30 years, to maybe just make a short response of how do we project our revenue and how did we result in an overprojection that fell short.
Okay, before that interjection, let's hear from the Vice Chair and Senator Sifuna.
Yeah, thank you, Chair. I'm looking at note 12, and I got interested on this revenue stream on conservancy administration, which increased from 1.2 million to 12 million in 2023-2024. And when I look at page 11 of the statements, that conservancy administration, the major increment was as a result of liquor licensing. That is on page 11, up there, which increased from 350,500 to 10.9 million. What was happening before, Governor? Does it mean that there were no licenses or liquor licensing in 2022-2023? So much so that maybe because of a law or just enforcement, we got this increment from 350 to 10.9 million, just for my curiosity, Chair.
Okay. Senator Sifuna.
Yeah, Chair, first of all, Governor, the SHA itself and the Ministry of Health has admitted that there were ghost facilities that were actually receiving payments. So it is not very fair to say that it was just about politics. The government itself has admitted that there were facilities that were getting payments from SHA that do not exist. There was also a list of facilities that was put out, that was banned. And one of the things the ministry explained is that people are registering names of facilities that are so close to each other. That is how they are facilitating the fraud. So the suspicion of Kenyans really was to seek answers, not to say that it was about politics. But I wanted to understand, ordinarily, just for the perspective of people who are not fishermen, like the chair, how much do you charge for these so-called landing fees? Because I want to understand something, Chair. How much is it?
Okay, as the Governor responds, I think on the efficiencies or inefficiencies of SHA, the person who should be sitting there is Aden Duale. Unless, Governor, you want to defend Duale's issues, just deal with your issues in Homa Bay. To avoid a very broad conversation that will take us to an area where you do not have subject matter expertise. I think what Senator Sifuna said is a fact, and it is not only happening in Homa Bay, it's happening across the country. I think for SHA, let's go back to how your numbers will look like with the introduction of SHA. I think that's an important thing for us to understand from Home Affairs.
Chair, you made me forget one other thing. In the disclosures themselves, if you look at note number 8, which covers the hospital fees, Governor, you have attributed the bulk of the money from, in terms of the income for the facilities, to payments from insurance and SHA. Now, you have only disclosed level 4 hospitals. Are you saying these are the only hospitals that are paid by SHA in the county? Do you have any other levels of hospitals? And where is the revenue from those?
And I think what we have seen in that kind of disclosure is that you indicate whatever rebates came from NHIF, whatever rebates came from Linda Mama when it used to be there, and whatever was collected from facilities. In this case, you have not provided that breakdown. So it's very difficult to establish the facts around what you had said. Could you deal with the liquor licensing? I know this committee has processed that matter in the past, but just put it on record. But help us understand, now that SHA has been introduced, because people think that there'll be no payment at the hospital, but then there are certain rebates that are coming. Will those rebates come back to the 800 million that you have been collecting previously? And then we'll allow the chair of your board to tell us about the budgeting process.
Thank you, Chairman. In terms of liquor license, you remember, Chairman, our first meeting in KICC, one of the things we were put to task on is whether we had mapped our facilities and whether we were, ready to push an improvement in that particular revenue stream. And we assured you that by the September of that year, we were going to have fully mapped our liquor facilities, and that was going to result in an improvement. So we mapped all our facilities, and we also mapped them to the system. So we have been able to push increase in liquor licensing by mapping all the liquor facilities, and also through the support by the Revenue Board and the reviews, the monthly reviews of what revenues we are receiving. That is what has resulted in that push. And that push is not just in liquor alone. If you look at the revenue streams, you will see that majority of them, just by leadership, monitoring, and efficient revenue management system and digitization, you're able to see much more revenues. Chair, we are not where we want to be in terms of revenue. We have room for improvement, and a lot of it. And we are daily working on that room for improvement. We are daily improving our revenue, and when we come back for 2024-25, you will see that a lot of the streams, again, we have moved further than where we were. In terms of the question of the levels of facilities that are receiving money, in 2023-24, we were on NHIF mostly, and NHIF was mostly giving money to level 4 facilities, with exception of Linda Mama, which was being given to facilities, lower level facilities that were charging. Now, with the SHA, now you have the reimbursement of the primary health care fund that is going to lower level facilities, and that's why we are saying lower level facilities are not expecting any money from the public. That is level 2 and 3, because they are getting the primary health care fund directly from SHA. So moving forward, Chairman, we have seen 2024-25, the revenues have actually gone higher. What has happened is out-of-pocket has reduced. And why has out-of-pocket reduced? It has been because of and I'm not speaking about for SHA generally. And the reason I also responded to the issue of Nyandiwa was I was responding to the specific Homa Bay question. And even the politics I was referring to was specific Homa Bay politics, not necessarily national politics in that sense. So what we have seen in 2024-25 is an increase. Why? Because and a reduction of out-of-pocket expenditure, but an increase in the amount of reimbursement. This is because SHA has removed the waiting period. The 2 months that you had to wait, the 60 days that you had to wait in NHIF. So if I arrive at a facility and I need to, spend 10,000, but my SHA for the whole year is 6,000, I will pay SHA for 6,000 and then I will receive treatment. So this has seen more people paying in the SHA, and therefore the amount of money that the hospitals are receiving in reimbursement has grown. And the amount of money people are spending on out-of-pocket has reduced. Not for any reason, just because people can pay immediately and get services. The viability of that, or the question of its sustainability and so on, I think that's what you said is a different question, and is a question to be answered by a different person.
There's a capitation. Is it 9,000 on average? It is
900 shillings.
So what does that mean? Is that what reverts back to the facility?
Yes, that is paid to the facility on the
Per
basis.
visit or annually?
No, is it per quarter? It's per person annually. It's per person annually.
Annually.
Yeah.
So is that equivalent to the reimbursement that you're talking about?
Primary healthcare fund, yes, for the primary healthcare.
So 900 per person annually means that you need 1 million people to make the 900 million that you're making now.
Yeah, a lot of the 900 million is based on SHIF. It's the insurance part, where you conduct a surgery, and one surgery will be 70,000, 100,000, even 200,000 sometimes. So a lot of that is in the category of the insurance, not of the primary healthcare fund.
Okay.
That is the level 4 and above.
Senator Wambua?
Chair, now, if this was answered when I was out, then it's okay. I'll get it from the Secretariat. But I'm just wondering, Chair, out of the disclosure, from the disclosure, the entire amount of money that is declared from the health sector as a source of revenue for the county, the entire amount comes from level 4. Is it to say then nothing was received from any other health sector facility? The entire amount to the cent comes from level 4.
It's a good question. It was asked by Senator Sifuna. I think the governor has addressed it. That was Linda Mama from lower facilities. But what the governor has not accepted is that they ought to have broken this down. Receiver of revenue. Receiver of revenue, as a member of the institute, you know what the template requires. You ought to break this down so that we are able to see the components. What comes from out of pocket, what comes from the other insurance funds.
Chair, thanks for bringing that up, because I personally don't believe that people of Homa Bay are not paying out of pocket. Our experience here in Nairobi is totally different. Maybe we need to benchmark. But because there is a ground person here, Chair, allow me to hear from the MCA there. If the sergeant at arms can give him the mic, I want to know his experience with his people there in his village. He can tell us his ward, whether really people are not paying out of pocket in Homa Bay. Because here in Nairobi, we are still having cases of people going to the facilities and being asked to pay money out of pocket, and it's not a small number. Honorable
Senator Sifuna, you'll allow me to give the directions.
that's why I asked you, but
we'll be careful not to mix what SHA ought to deliver globally versus the responsibility of Homa Bay County. Because I hear you, I feel you. You want to pick a sample, and we have seen there are issues around SHA. There are issues around SHA. And but it is not for this governor to defend SHA unless you became the government spokesperson.
No, Chair, you know, when I was speaking, you were a bit distracted. You have framed it for us that we needed a breakdown. Yes. To see what really is the situation. Because when the county claims that the bulk of this money is actually reimbursements from SHA, and we in our counties are having challenges, we have to interrogate. Maybe there's something we are doing wrong, or there's something that we can learn from Homa Bay.
Was there SHA in this financial year, or this was NHIF?
This was NHIF because SHA started in October, which would now become the financial year 2024-2025.
Correct.
So what we're discussing now is NHIF.
So this is NHIF. So and maybe the question is the NHIF outstanding reimbursements, whether they were received in full. Because I think that's a national problem for this particular financial year.
No, Homa Bay is owed over 100 million, in NHIF claims that were not fully given to us.
So ideally, this should have been at least 941 million, if the 100 million had come in.
If the 100 million had come in, yes.
Okay, so members, I'm not defensive. I'm just drawing the line that these are numbers relating to NHIF, and SHA will be in this current financial year.
Yeah, there was a discussion that happened prior to this meeting beginning, where we were suggesting that maybe we should let the vice chair chair today's meeting. I am increasingly getting convinced that you need to move to the next chair. Because this is your home county and you might have biases that you might not even be aware of yourself. Because we want to learn. We want to learn from what Home Bay is doing. The rosy picture that has been painted, for us really doesn't make any sense because we have different experiences in our counties. So when I request the MCA, he's here. Let him tell us his village, the one he represents, is what we are being told the situation that is obtaining on the ground.
That is in order.
And
for the record, my vice chair is also the vice chair of ODM, so that is also not very useful.
Can I chair?
but Chair, I wanted to Chair.
Okay, order. Let's get back to the issues.
I wanted to be very clear that a big portion of the money that we are receiving is from insurance. People also pay out of pocket. That is also a situation. People also pay out of pocket. But if you compare it to the percentage that we receive from insurance, the percentage from insurance is way higher than what people are paying out of pocket, particularly in the financial year that we are speaking about, which was 2023-2024. But even now, people still pay out of pocket, but the percentage that is paid out of pocket, and this is not because of that the numbers are few. It is because that what people can afford to pay out of pocket is much less than what the insurance will reimburse. For example, if you have 1,000 people paying 1,000 shillings, and you compare it to just one procedure that is going to bring in 100,000, that is why the amount that is being paid from insurance is higher than the amount that is being paid out of pocket. And that is what we explained. And the amount of money that has been consolidated there should be broken down. Because in our financial report every month, it is broken down as level 4 facilities by name. I don't know if we can get just a sample report that we receive at our revenue roundtable so that the senators can see it. It is the level 4 facilities. It is the other facilities, that is level 2 and 3. They are put under one line because there are many. And then it is public health revenue. And then in that report, there is FIF, and then there is what the insurance is going to pay. There is the money that people are paying from their pocket, and then there is money that is paid over a
So, Governor, to help you, going forward, we must demand on that. We must demand for that disclosure. I think that's the reason why this question is arising, because we are used to seeing that breakdown in other county reports. Do you want the MCA to respond first? Or?
Yes, he will. But I just make a comment on what she just said. You know, that which she says would have been given to us, if we had it, well, there will be no question. But you see, we don't have it. What we have is a disclosure of 841, all coming from level 4. We can only engage with that. We cannot engage with what we don't have.
Agreed. Governor, you get the point that that disclosure ought to be there. And if it's available, just circulate it. I think it can help to allay some of the fears that we have.
Chairman, we can share a sample of 1 month report as we receive it. We can send it to George.
Send it to George.
And
he
then
can circulate to the members.
The facilities are listed. Then the level 3 facilities are lower level facilities are listed. Then the public health revenue is listed, and then it is broken down, and it is from all facilities.
Okay. The Honorable Wanga, don't make a speech. Just deal with the question raised by Senator Sifuna, even though the governor seems to have touched on it. The question was whether Senator Sifuna just frame it precisely, or Wanga is a politician. He might start singing and making a speech.
It's a yes or no. Are your people being asked to pay anything when they go to hospitals? It's that simple.
Thank you, Honorable Chair. Because I've been given a conditional question, and you want me to say yes or no, the answer is yes.
Thank you.
Yeah. And I think the governor, you alluded to it. Yes. So some of the things we are hearing in the political platform might not be factual. When you're told that uende hospitali level 1 up to level 4 na usilipe chochote, but kwa ground things could be different. But since this system started in October, I think it is in this forthcoming financial year that we'll be able to get a better view on it. Now, we had said that the chair of the board was to help us to understand the budgeting process, but I want us to deal with a very specific issue on the system first, and then I'll ask the chair to speak after that.
Chair, I have queued for some time.
Oh, sorry, Senator Cherardi.
I think you should not.
Because the system question, you're the one who asked.
Yes.
That's why I wanted to
You are
respond.
doing very well. You should not be intimidated since you are presiding over your county. But just avoid a few biases here and there. Chair, I just want to note number 11, higher of county assets. Governor, the higher of stadium, park and open spaces, you in 2023-2024, and I want to assume you came into power towards the end of September 2022-2023 after being sworn in. You raised 1,723,726, but in the previous financial year, you did not raise anything. What is the reason? That is page number 10. Because I think there is a park called Senator Moses Kajwang. What is the park in Homa Bay? It's called Weno or Werwa. What was the name? Do you have a park? The MCA, Waka.
No, I think put the question to the governor.
No, apart from governor, when was Raila Odinga Stadium complete and become being used by the public? And then number 2, how many park do you have, as in wildlife park or any other? And these open spaces, what do you mean by open spaces? Does it include the what do we call, the auditorium where people are watching Chan matches? Because in the previous year you collected 0, but in the following year you collected 1.7 million. It is your financials. So what is the challenge?
Dr. Lelegwe, Senator?
Chair, on the same questions on performance, I've noted at note 11, not note 11, but under notes 11 of financial statement says agricultural produce road fee has declined from 24 million to 12 million in 2023-2024 financial year. And fairly, when I look at all your revenue streams, this is clearly an outlier, decreasing your revenue at CES.
And assess on page 8, that's not 1.
Yes. Page 8 at the top there, and not 1. There's a decline by 50%. And when you look at your other revenue streams, most of them has registered positive growth. What might be the reason why at 2023-2024, there was a 50% decline on the agricultural produce road fees?
Governor, let's deal with these issues very quickly so that we move to the other issues.
Thank you, Chair. Chair, in terms of the stadia, and I think Chair Argei has left, but I'll just
just respond for the record.
The Raila Odinga Stadium was opened in July 2023, 1st July 2023, which means that the year 2022-23, it was not in operation. And when we opened it, then we got some teams that were now playing, like Shabana, that gave us the revenue that we raised from the stadium. The other open spaces are like the Governor's Park, and now we have an arboretum and also the amphitheater at the lakefront. We will be able to collect some revenues there for weddings and other things, just activities and events, but not for individual persons using the facilities. In terms of the agricultural produce road fee, a lot of the...
The question by Cherardi was in the 2022-2023, there is zero collection.
in
Can you see that,
2023.
Governor? That is note number 11, page 10 on your ROR.
But there were other stadiums.
There was no
before Raila
stadium.
Odinga.
The stadium was not complete.
There was no park, there was nothing.
There was no park, animal park, you don't have?
No,
Even snake park?
animal is different, Chair, Senator Cherage. The Ruma National Park is the game park that we have, but we do not receive any revenues from it because it's a national park, not a game reserve. So the revenues go directly to Kenya Wildlife Service.
So there was no stadium, there was no park, there was no open spaces.
That is how much work we have done in the time we have been in office.
Okay, Governor, let's proceed a bit faster. The agricultural produce road fee.
Here, Ndiwa Sukari, which is the main producer of cess, was closed for a while for repairs, and therefore we lost quite a bit of cess in between. And we also had Kibos that was taking sugarcane from Homa Bay to Kisumu, and they also left during that time. So that is the reason that we had the decline in the agricultural monies. Thank you.
Honorable members, I want to request that we look at the systems environment, wrap this up, and then go to the issues in the main executive report. Auditor General, you had an observation on systems environment, and I think you had indicated that there's something that has not been resolved. Very quickly, can you read your finding? As the Auditor General takes us to anomalies in the revenue collection and management system, the issues raised and evaluation role, we'll take note of the responses. This is a matter that should be kept in view.